And before we start today with our two speakers, I just wanted to say a quote by Vivekananda. He had this to say on yoga: "This is no child's play, no fad to be tried one day and discarded the next. It is a life's work, and the end to be attained is well worth all that it can cost us to reach it, being nothing less than the realization of absolute oneness with the divine." So now I'll introduce Dr. Naveen Visweswaraiah. He's an associate professor at Vyasa, India, and co-PI, ICMR, and he will be speaking about Yogashree, Stress and Lifestyle Clinic, a working model of integrative medicine in Bengaluru, India. In this session, we will see how this integration is done and what it takes for a healthcare provider to provide such a model and how it helps the patient heal faster. Please welcome Dr. Naveen Visweswaraiah.
Not an academic presentation. This is more to share our experience of our attempt to test this concept, as they say, proof of concept in executing an integrative medicine center in India. The background being most of you who are in traditional medicine at large here, and for us in India, Indian medicine, we do know that globally there is a transition from referring these bunch of therapies or strategies or medicine, systems of medicine, as alternative to complementary and then now to integrative. Now, the progress has been that physicians, medical community at large has recognized that this is important and we need to combine and look at joint strategies. Yes, here we have slides. From somewhere it's coming though, so which is nice. So this is the, as I told you, two organizations which has come about to test this concept of integrative medicine in India. I'll talk about both of them in subsequent slides. Now the current scenario is that world scientific and medical community is woken up. And we have these three declarations which supports the agenda of a very aggressive, comprehensive approach to combat NCDs across the world, both in developed and developing world. Now, we do know that non-communicable diseases spread across large number of medical disciplines, and these are specific disorders that I have put in here, which are important to us in two ways. One, that these are the prevalence of these disorders are very, very high, and we have considerable evidence for each of them in most of the Indian medicine and of course in integrative approach. For those therapies that we want to use appropriate to these, we have considerable evidence. Now this is something that we have to remember, and this is going to go up every passing day. Now that brings us to Indian scenario. How are we different compared to the global scenario? The news is not such a good news, because we still are battling starvation deaths, and we have large number of obese children and adolescents and adults. And then we're still now already declared with largest number of diabetes mellitus patients. Every sixth Indian apparently is pre-diabetic or diabetic. And soon we will have largest number of heart patients for any given country in the world by 2020. But then we're still battling large number of infectious diseases. So here is a country where we are trying to work with disorders, classical disorders of developing world and of developed world. So that means the healthcare burden on a country with 1.2 plus billion population. So we can imagine the burden. Now, so this is of course an academic record. Now, if you want to look at more progressive, proactive strategies to deal with them, one of the basic things that is required is to know the impact of these disorders in terms of morbidity and mortality. And this is very central record. And this is an interesting fact that I picked up from WHO report, that India is one amongst those really, really underdeveloped countries which does not announce or declare official records of death. Although it's not a good news for us, I thought it's important. We really have to start from somewhere there. Now, I did say this as a background. So now we have reached this situation where mainstream medical community, rather than traditional or Indian medicine community, is interested to bring these two together. Now, there are a whole lot of very significant movements. Now, these are the recognized bodies for different disorders, and these are the themes, either currently in operation or has been in the last 3 years. Or in this case, for example, Diabetes Federation came up with the 5-year common theme for the first time in their history, with one simple theme called physical activity. And WHO had 2 consecutive years where they just talked of bringing people outdoors and making people move. So the whole lot of general lifestyle agenda in the minds of these professional organizations. Now, there is an organized medical movements and academic progress in these disciplines, and the prefix is increasingly being added. And now we see there are departments which are integrative to any of these. And when universities in North America, Australia, and some countries in Europe start to think of an integrative medicine, they tend to specialize in any one of these areas. And that's how these prefixes just added, and then a bunch of adjunct professors from these disciplines join together and start integrative medicine centers. For example, Stanford is known, world-known center for aging and health and use of traditional medicine in aging studies. Now, these initiatives are very well structured. We have centers for integrative medicine within the medical schools or universities. There are journals of integrative medicine, the professional associations. One of the first one to start is integrative oncology. We can imagine why. And the government policies for integrative medicine. And of course, this is something which is central for us to move on, also being talked about. So for today, for our purpose, our focus will be just talking about center, because we are talking about one such center in India. Now, the starting point obviously would be evidence. In fact, Dr. Nagaratna did mention this in her talk, that have we got to a stage where we can talk of this? Do we have enough evidence? And where do we stand in terms of Indian medicine pitched against other traditional medicine? Now, this table will give us that answer. Now, look at the number of studies as on today morning, 9 a.m. We have 1983 studies in yoga. We have a lot more studies in meditation, because there are a lot other forms of meditation other than yoga-based. And of course, massage therapy, there are 10,000 plus, chiropractic 5,000 plus. Not many, because this is not also much available in North America, mostly in Australia and UK, if at all. Now, Ayurveda 2,000 plus, close to 3,000. Now, these are the numbers to watch out for. Now, if you really look at the status in here in India, it's a different scenario. But globally, when you compare acupuncture and Chinese medicine with yoga and Ayurveda, we get the answer straight away. So Chinese medicine, we have close to 70,000 papers. Traditional Chinese medicine, apparently that's the name given to herbal medicine component of Chinese medicine, so close to 24,000, and acupuncture close to 18,000. Now, if you compare that with yoga and Ayurveda, we are not even 10%. So that's the reason why yoga today, in the eyes of medical community, is still a fitness strategy, not a healing system. And Ayurveda is still a food supplement and not a healing system. And all of us in India are not very happy with the fact that from 2010, Ayurvedic products are banned officially in European Union. So that's because, we don't have enough studies to back what we are saying. Now, is there any success story, and is there any model that we can embrace? Yes, if Chinese have done it, their acupuncture, which is a lot more subtler, there's no body work, there's no breath work, there's no mind component. We are talking about subtle life energy channels and pricking some of the points, supposedly energy points, and then looking for clinical benefits. Is a healing system, as opposed to a lot more pragmatic, tangible body, breath, mind work. Yoga is a fitness strategy. Now, traditional Chinese medicine, I'm sure some of the Ayurvedic physicians here will agree, will have probably 1/5 of the herbs in their pharmacopoeia as compared to Ayurveda. And the concepts of human body, health, disease is a lot more mature than that of Chinese medicine. But still, it is nowhere near to that of a healing system. Now, what Chinese did, here is a China model. Again, some of the administrative details which propel this kind of progress. 50 years ago, Indian government passed an act where they decided to keep Indian medicine outside the mainstream medical infrastructure. They said we'll have them separate in terms of education, regulation, and clinical practice and services. Whereas China, around the same time, probably plus or minus 3 years, passed an amendment, said every single medical infrastructure, be it college or hospital, should have traditional Chinese medicine unit. And they started incentives programs. And about 15 years ago, Chinese government did something very smart. They created a global endowment for Chinese medicine research of $1 billion each year. And specifically, these grant was used for North American and European universities, which is why we have American Journal of Chinese Medicine, which came up well before Chinese journals. So they really saw the fact that keeping traditional medicine within the ambit of mainstream medicine is the way to go. And unfortunately, we didn't do it, and we have the results before us. Okay, now, are we ready to take this approach? Is it the right way to go? I personally think yes, because there's no way other than generating evidence, critically evaluating traditional medicine, and embracing them into the mainstream medicine. So, which is why, although I am a full-time faculty in a yoga university and I've spent more than 15 years studying yoga in the context of neuroscience, I said a couple of years from now on, we should spend time. What is the use of, let's say, Vyasa or as a whole, out of 2,000 plus papers in meditation and close to 2,000 papers in yoga, even if we have half of them coming from India, the reality is, which is also reality here, that these research studies are not accessed by yoga therapists or yoga instructors. So they don't use it on their daily basis, on their daily classes, either for wellness or healing purposes. So therapists or instructors do not use this. Patients do not know about this. Physicians, except those who are researching these traditional medicine or Indian medicine, don't use them. So it's more an academic activity for us than actually turning it into an evidence-based practice. So which is why we founded this with Dr. Shirley Tellis, myself, and 2 other colleagues. We decided we'll start an organization which will first take up the activity of assessment. Now, you can't not critically evaluate any of these systems before you think of integration. Now, this is important to address 2 groups in two distinct domains. I think I have it there. Okay, so let me say that here. Now, assessment is for Indian medicine or traditional medicine institutions and physicians. I give this analogy to people when I talk to Indian medicine professionals, that it's like our monsoons. We are very, very accustomed to having floods every year after every monsoon. And we really don't think of using the flooding waters to combat the drought which is going to come just after that. So we have large number of Ayurvedic physicians, yoga physicians, naturopathy physicians, and others with thousands of institutions, hundreds of organized colleges, treating so many patients. We really don't have any data of that clinical experience. So these clinicians and institutions need to be trained in research methods. Government of India allocates close to 50 crore rupees for research training of Indian medical physicians every year. I don't know what some of you can do that quick translation of that money in dollars. Now, that is one part, and that is an ongoing process. Now, integration. Now, we have these 2,000 papers in yoga. To take an example of diabetes, because that's a prevalent disorder in India, there are close to 80 plus papers in yoga and diabetes. And if I run a survey of endocrinologists, I don't think even 10% of endocrinologists will know anything about these papers. So which means there is evidence, there are people who are testing this. There is a specific module for yoga for diabetes, but nobody is knowing and using it. So we need to go out to these people, like China did, and say that, look, there is enough evidence for you to get started. If not conclusive, there is enough to get started, and it's only here in the mainstream hospital that we can generate or robust evidence. So that fitted into a nice acronym called FAITHS. So the Indian medicine or traditional medicine, which is also referred to as faith healing, is no longer will be faith healing. Now, FAITHS has multiple domains as its objectives. Three of them main objectives being research, education, and clinical services. Although for me and Dr. Shirley, the priority is education and research. And we have done large number of education programs for Government of India under this organization with FAITHS and SVIASA. In fact, most of them are housed in SVIASA, although it was executed by FAITHS. Now, when we started to talk to these physicians in Bangalore, virtually in more than 10 corporate hospitals, I'm saying this particularly, there is a structured program for public or government-run hospitals, what is called mainstreaming of Ayush, where they're trying to integrate Indian medicine with conventional medicine. But our private medical healthcare providers, which amounts to 90% of our healthcare provision, they are not connected to these government initiatives. So when we started to talk to these people who are our research collaborators, they say it makes sense, but we don't know how it works. So we need to see a prototype. And that's what propelled the birth of Yogashree. Yogashree, for some of you who are not familiar, it's not a yoga. The word yoga is not used in the context of yoga the way we use in yoga. Yoga here is acquire. So from our birth to death, we are acquiring human experience. It could be matter, material, or people, or any human experience. And whichever is good, we want to preserve them, and that is kshema. So we're busy acquiring good experiences and preserving them. And one of the major domains of that acquire and preserve is health. So that's how the word Yogashree was chosen. And now, should we call this an integrative medicine center? We said it's going to be premature. In India, integrative medicine would be a very new, naive, unknown name for many, many patients and professionals. So we said, let's give it a name which is a little more easy for people to understand. A central problem in this is stress and lifestyle, and the solution has to come in dealing with stress and lifestyle. So we said we'll call this as a Yogashree, a stress and lifestyle clinic. Now, this logo is evolved to incorporate what is categorized, classified in WHO and NIH and in ICMR, as the entire global traditional medicine is classified into four of these: conventional medicine, herbal medicine, energy medicine, mind-body medicine. So pretty much all therapies can be tucked into any of these four. So the future medicine, which is integrative medicine, needs to have equal component of all of these. Now the setting. So we have conventional medical setting, and Yogashree serves as a daycare setting. The daycare setting has a different connotation here. It's OPD, outpatient clinic in India, is what referred to as daycare. And we have Vyasa, the Prashanti Kuttaram University campus, and attached 200-bedded hospital. And we have another holistic health center that has come into our fold, which also serves as an inpatient setting, which I refer to as a retreat setting. There are a few photographs here to give you visualization of this place. One of the prominent ministers of state of Karnataka inaugurating the clinic. This is inside, and you'll see some of the familiar faces, Dr. Shirley, Dr. Nagaratna. This is how it looks. It's a 4,000 square feet area on a very prominent, a very centrally located place in a very distinguished area of city of Bangalore. A bit like Palo Alto, I would say probably Palo Alto of Bangalore. And we're very happy to have this place from a philanthropist who is kind of tracking my career for 20 years. And one fine day, in virtually about 7 o'clock, a dark evening, he brings me and tells me that this used to be a FedEx godown for 14 years because the old airport was pretty close to this place. And he says, this belongs to some of our friends in US. The owner of this place is a doctor, urologist. And this was built to be a neurology clinic when he became doctor by his father. But he chose to come and practice in US. He says, now my friend says this should be used for medical purposes. And do you want to use this? And I said, are you really serious? There's no way that I can afford a 4,000 square feet place. So he says, no, this is for your trust. So you really don't have to worry about commercials of this. And that's how we got this place. And we're close to now 7 months in this. Okay, now how have we structured this clinic? So we have specialty consultations, which is with conventional and traditional medicine. I'll explain how we are different from other places here and in India. And then we have 3 specialty clinics: stress clinic, pain clinic, lifestyle clinic. And there are subsections to it. I'll come to that in a minute. So this is how the whole thing is structured, and there's actual photo within the lounge. So you have stress clinic, a biofeedback studio, yoga therapy studio, pain clinic, lifestyle clinic, and nutritional clinic. One other thing that I want to focus here is we have doctors in each of these disciplines who come and practice their general OPD practice for 2 hours, and otherwise they're on call all through the day. And we have these Indian medicine doctors who are employed in the clinic. So they work together as opposed to a shop-in-shop approach. I have a slide for that to make those distinctions. Now, what is the paradigm shift that we are embracing? The entire world practices physician-centric medicine. What it means to say is that my health is the responsibility of my physician. So I choose to do what I want to eat, what I want to do, what I want to think, the way I want to live is my choice. But when I go wrong, I really don't want to do anything about my lifestyle or myself, and my doctor should just fix it through either medication or surgery. Now that used to be the practice, and we have this Bollywood movie showing I'm sure all movies, physician would walk in and say, okay, I've done everything, given the medication, and the spouse would ask, what are we supposed to do in terms of food and other things? And the doctor would say, don't worry, he can do what he wants to do. So that used to be the medicine, and today we are increasingly recognizing that active strategies where patient has to do something for themselves to heal themselves. I have less time, so let's go a little faster. So what we have today across the world is physical integration. We have number of therapists in one single place available in one center, but it is still patient has to make the choice. It's really not rooted or advised or prescribed. Now, what the process of that kind of process would be called functional integration, where of course it's all under one roof, but it is traditionally evidence-based but prescribed. Now, further on, this is what patients are doing in the absence of a structured system, and this is what we are hoping to do in our center. Now, just another point here is a typical prescription pad looks in our clinic is where we would evolve treatment objectives, and you would have prescriptions of all the treatment strategies, and the choice of that would be based on evidence. There is a first line of treatment, for example, PCOD. The medicine textbook would say that PCOD first line of treatment is a weight loss strategy, physical activity and nutrition, which is yoga and naturopathy and any of those. For example, Parkinson's, they say at certain grade, for 1 full year, we can try everything else before we actually get into medication. So the first line of treatment is based on those kind of clinical guidelines. And then you will have, so it could be even medication, and then the traditional medicine could be a subsidiary or supportive treatment, or the vice versa. So we have medical consultations. So what does stress clinic do? So for the first, when I Googled before we started naming this clinic, there are 2 stress clinics as stress clinics in the world, one in Dallas and one in Oxford. And both of them are psychiatric clinics. So in other words, people are talking about stress, but they're not really doing anything about stress before the stress-related disorders are either psychiatric disorders or non-communicable disorders. So we wanted to actually evaluate. Yeah. So, so I think I really have to sum up. So this is what we do. So we have clinical events, signs and symptoms, psychometrics, physiological markers, and biochemical markers. And you get what is called stress profile. Now this is something that we have to evolve. We have some leads in each of these. And this could potentially be used to predict an onset of a lifestyle disorder or a stress-related disorder, and could also be used to predict the recovery. If somebody has already gotten to the disease, how long or what could be the milestones that we want to see in the remission or regression. I'll skip all of this. So these are some of these domains of stress, details. So these are the classical types of stress, and this is a setting where a polygraph, which is 2-channel to 16-channel, can be used to have the physiological markers, and that's how it looks. It can also be used as a biofeedback tool. So we have biofeedback. Quickly, one point here. We use biofeedback as biofeedback in those patients where yoga instructions cannot be given. Psychiatric patients, developmental disorders like autism, ADHD, and other disorders where instructions cannot be given to these patients. So there we use biofeedback. And biofeedback is also used to demonstrate that a good breathing and a good thinking can actually, in real time, influence physiological system. So thereby, the compliance for yoga therapy increases. And that's an issue in yoga therapy. So I think I'll skip this. We have talked enough about yoga therapy. The one thing that I wanted to, if any one of you have wondered how disease-specific yoga therapy modules are evolved, these are the 3 inputs. Now, much of yoga therapy is done in this domain, and this is how it is done, and it can all be attributed as wellness strategy. If we want to bring it to healing, this is what we need to do. And that's what we hope to do. And we have small 2 yoga therapy rooms. We do small group yoga therapy sessions, about 16 sessions done every day for about 8 disorders. Pain clinic, now typical pain clinics use either anesthesia or surgery, other than painkillers. Now, we have different strategies which are called passive and active. Now, I'll come to that. So there are passive pain strategies when people have acute pain, and then once that is done, you really have to get into active pain strategies where you don't have a relapse of the pain. So details on that. We are the first one, or rather second one in the country to import chiropractic-based spinal decompression. Now, increasingly, if some of the physical therapists are here, you know, over here, the traction is not very commonly used as it used to be, because we end up harming some of those vertebrae which is not affected. So these are the range of problems that comes by virtue of the compression of spine is shown to be benefited by spinal decompression. So we have that. We use this in this clinic. This is the first one to be using in South India. And then, of course, we have active pain strategies. Now, lifestyle. Now, it's very difficult to define lifestyle clinic. So we had to first list out what are the things that the risk factors in bad lifestyle, and then define good lifestyle. And then how can it be a prescription? And then how can we define evidence to such a prescription? Okay, so talking of functional integration and lifestyle prescription. So this is the way to go, where from being just palliative, which is really vague term, we can get into the specifics where all of this makes a lot of sense. A continuation of that, probably the next one would be rehabilitation. Right? So medical and psychiatric rehabilitation is where we can use traditional medicine very, very actively. Now, another thing that we do for every single patient, I'm sure most of the Ayurveda physicians do this, and in Yesvyasa we do this as a default system. We do dosha and gunas and then start prescribing, looking for prescription. So more photos. So there is a big billboards like this for health education around the center because we are in a nice place. Now, what are we doing? So we're coming out with a concept paper because this is what our doctors asked us. They wanted a prototype, so we have a physical clinic and we have concept papers. Now, these will be published. The position paper in terms of capacity building. Now, what we are hoping to do is we are talking with these corporate hospitals. So half of this space is required to set up a stress and lifestyle clinic in every corporate hospital. So if you have a stress clinic, a pain clinic, and a yoga therapy space, and treatment therapy room for Ayurveda or manipulation, that's good enough. So when a patient walks in, I think, yes, I should stop. Walks in, you really don't have to go elsewhere. So you have your endocrinologist and everything is given as a prescription, and you come out with a lifestyle prescription along with medication for virtually every disorder. So I close with this quote. The doctor of the future will give no medicine but will interest in patients the care of the human body, diet, and the cause and prevention of the disease. Interestingly, it is said by Thomas Edison. Yeah. So thank you very much. I don't know I have time for any questions. Any of you, Raghuramji is going to speak. I think we can take questions together, Raghuramji. Yeah, so.
Thank you very much. Speaker is Yogashree N.V.Raghuram. He is the chairman of Yoga Bharati and professor at Vyasa, India. He will be speaking on the concept of prana and pranayama practice. The concept of prana, as given by the ancient Indian scriptures, makes such profound sense. Prana is the cause for life. Prana itself cannot be perceived, but its effect in the form of respiration or pulse or some other sensation goes on. In this presentation, we will see different classifications of prana and how pranayama helps us transcend both prana and mind. A brief session on concept will be followed by a practice of pranayama.
Let me try to simplify my talk because I have very little time. But let me give some salient 10 minutes more. Thank you so much. If Ashwini gives, I'm assured. Oh, okay. Priyanka. Priyanka is the boss. Many books I come across prana is breath. Many times even some books even mention that prana is the oxygen that you take while breathing, etc., and it is absorbed by the body. My simple mind had a question saying that child is there in the mother's womb for 9 months, not breathing. Do we say that the child doesn't have a prana? I don't agree with that. I think child has prana. So prana must be something which is much more fundamental than the breathing. Rather than thinking that the breathing gives prana, prana gives breathing. Maybe that's the right kind of an approach. In fact, in order to just try to feel that, I would like to give a small little experiment. We'll all try to do it. Sit comfortably, close your eyes, don't make any movement. And then observe your breathing at the tip of your nostril. Breathing in, breathing out, going on. Don't try to meddle with that. Let it happen very smoothly, naturally. You can feel the cool air going in, warm air coming out at the tip of the nostril. You are not holding breath anywhere. You are not in a hurry to inhale or exhale. Gently go along with the inhaling breath from the nostrils up to the throat. Feel the breath at the throat. You can feel the inward journey of the air, outward journey when you exhale. From the throat, now gently go all the way to the depth of your lungs. You can feel the lungs expanding, inhaling. contracting as you exhale. Now slowly start observing whether the breath is going in and pushing the lungs out, or whether the lungs expanding, giving room for the breath to go in. Now there you notice it is the muscle movement which is making the air to go in and go out possible. The muscles contract, you breathe out, muscles expand, breathe in takes place. Now observe the energy, the force which is behind the respiratory muscles. That energy which is responsible for movement of respiratory muscles is what is called as prana. And breath is a much later consequence. When the air is outside, you call it as air. When it is inside, you call it as breath. But other than that, breath and air is one and the same. Open your eyes. What we are talking about, prana, is that which is responsible for the activity of the respiratory muscles. Now when we are outside the mother's womb, it is acting on the respiratory muscles, but when you are inside the mother's womb, that respiration is not happening, but all other activities are happening. That's how basically prana is that which is responsible for all the activities that are taking place within us. The respiration is possible because of prana. It is not the other way around. The same way, the prana is the same thing which is responsible for your heart to beat, your muscles to, your nervous system to function. Eyes see because of prana, your ears see because of prana. So all these things are because of prana. When you withdraw these activities, all that energy is in the prana. Vak pranam apyati, chaksha pranamiti, shrotram pranamiti. That's what is the idea. So essentially when we say we are doing pranayama, we are not actually actively trying to disturb the breathing or anything like that, but we are trying to control that energy which is responsible for all inner activities. Now what happens is that all the inner activities are created by prana. It is like the way that in a tire there is a pressure inside the tire, and then you check the nozzle, you reduce the pressure at the nozzle, the entire tire pressure reduces. The same way, the entry point to see able to manipulate the prana for us is the respiration. So you slow down the respiration, other activity slows down. You are agitated, mental activity is high, and then you can see that the breath rate is also very high. You slow down the breath rate, mental activity slows down. Somebody who is met with an accident, panic, you can see the BP high, heart rate is high, pulse rate is high. But you ask him to just lie down, take deep breath, everything comes down. That means to say, breath is an essential entry point for us to manipulate this. In fact, you can see in the children. And what is important thing about this understanding of prana is, when you are in anxiety, when you are angry, when you are agitated, you can see the prana is high. When you are soft, gentle, calm, peaceful, prana is slow. Inner activities are slowing down. Anger is a state where the inner activity is high, mind is fast, the prana is also fast. Child comes running to the mother, angry, upset, disturbed, agitated, complains to mother saying that, look, next door neighbor boy, he pushed me down and all that. Mother can't understand because he is not talking properly. Say, hey, yeah, I can't understand what you're talking. Just close your eyes. Take deep breath 3 to 4 times. Are you okay now? Yeah. So tell me what is the complaint. Okay, let me go and play with him. See, the moment that you slow down the prana, anger slows down. Anger comes down. Try to get angry slowly. I can't. See, that's a simple idea. So, the whole idea of pranayama is to see that how you slow down your inner self. There's another important aspect of it. It is when the prana is slow, gentle, soft, that means to say it's not just breath, the whole inner activity slows down, then you can transcend the prana. Pranamaya matmanam upasankramati. Your identification with prana, you can get rid of it, you can come out of it, and you can go to a deeper level. And that's what is mind. And then that's what Taittiriya Upanishad says. You do the practice at the mind level to see that how you can transcend the mind. Manomaya matmanam upasankramati. Like that if you go, finally you become Ananda yourself. But then he says that the real Brahman is where Anandamaya matmanam upasankramati. So this journey made possible, and one step in between at the prana level to see that this spiritual journey takes place, to de-identify yourself from the body and identify yourself with the consciousness. And one step in between is this particular pranayama. Now, very lot of things are there, but I don't have much time to go through. But so let me just give a few ideas. Based on before the red light shows up, I just want to close it down. So before all these different prana activity that's going on, our sages have divided this into different kinds of prana based on its type of activity. It's all the same prana inside, which is called as the mukhya prana, which they call it. Based on its activity, they divide it into various groups. Like, for example, to and fro activity, up and down activity that's there. That's what they call it as prana. And that's what is responsible for respiration, that's what is responsible for heartbeat, etc., etc. And the heart is the center from where that all these activities take place. And then there is some upward activity going on. Like, for example, your thinking, seeing, etc., etc., this upward activity. And that's what is urdhvam gacchati, udanaha. Udana is the upward journey. Similarly, there is downward activity, urination, defecation, that's what is apana. I mean, each one is so unique, extraordinary. Like, for example, whatever that food that we take, whatever the water that we take, anything, and then whatever that is useful retained and whatever that is useless is continuously dispatched, thrown out. Such a wonderful activity. That's what is apana does, throws out. And whatever the hearing, thinking, all this upward activity is what is that udana is doing. Now, apana has another very special activity also. Like, for example, the sexual activity is also by the downward activity. In fact, sexual activity is not a simple thing. It has such a great, extraordinary, wonderful purpose. Like, it has to collect the whole essence of your body, your essence, your system, your mind, not only yours. Look at the way that several generations it has to collect all that, and then it has to dispatch. It has such a big responsibility on that. Your semen that comes out and the egg that forms, it has such a big work. It's a work of that particular, the creator. It's an extraordinary, wonderful work. So that's why if you are able to be the master of that, and then that is what is brahmacharya, because Brahman is the creator. What an extraordinary, wonderful thing. We never think of it, and we simply abuse it. In fact, our sages recognize that it's not something that you should abuse. It's something which is so extraordinary. You need to take care of it. That's what is the downward activity, and then that's what is upward. And if you take the upward activity, udana, it's also another wonderful, because udana also has this memory. And this memory, like years and years of memory is there with you. In fact, all other prana activities, like for example, before I go to the udana, let me go to the vyana, which is supposed to be all over the body. That is touching sensation, it is radial. Like the prana that goes inside and comes out, I touch the feeling sensation and then goes out. And this all touching sensation. Anywhere your body, you touch it, immediately message goes. And then look at the way that immediately the message goes. Come on, take out your hand, it's hot. everything happens instantaneously. Instantaneously. I mean, what an amount of responsibility the touching sensation has. Like all other senses God has given us, like ears to hear, eyes to see. I mean, many times eyes are there, even then we don't see, but anyway, it's there to see. And tongue is for the taste, and there also you can see that certain part is to give you a taste of sweet, certain part is to give you different taste like that. Similarly, God would have provided us one sensory organ to touching sensation. Like, you touch with your finger, and then you can touch everything He could have given. But, He's smart, not like us. He provided that touching sensation all over the body, everywhere, throughout the skin, because essentially that, if He had given us one sensory organ to touch and feel it, anywhere else, if some fire happens and then something is burning, I don't even notice it, right? So touching sensation you require throughout the body. He is very intelligent. He should be given a Nobel Prize. So touching sensation takes the responsibility of protecting the whole body, like that. Now, this is what is vyapakatva hiti jnanaha, that is which is everywhere. Now there is one more thing, that is this apana, upward force and downward. There is something called as samana, which tries to, the sama in English people translate as equal. It's not equal actually. It is continuously trying to balance. Like for example, you are hungry, you take food, the message comes from within that look, you have eaten enough. That's what samana. To listen to samana or not, it is left to you. But samana gives its information very clearly. Similarly, look at not only in the wakeful state, in the wakeful state, like you are climbing up the steps, you are climbing up the hill, you need extra oxygen. The samana judiciously manages to see that you breathe deeper so that that balance is created, that harmony is created. Look at the way that it is trying to create that harmony within you so much. Not only in the wakeful state, even in the sleep state. Like you are sleeping, you are exhausted, you go to sleep. And the moment that there is a harmony exists between your relaxation and the sleep and also the exertion, you wake up. Who woke you up? Samana. Subtly working within you. In fact, so much subtly it's working that you are in deep sleep and suddenly the outside weather becomes chill, and then you immediately pull yourself the covers. You don't even notice. Wow. How much it's taking care of you. So, not only in the wakeful state or sleep state, but even in the comatose, in a state of comatose, you are absolutely unconscious. The inside, the repair work is going on, system, and then once the whole thing settles, you wake up. You come out of that state of coma. Once it so happened, I was so exhausted when I went for engineering, at that time. I just felt so exhausted, I went to sleep. And then I just woke up, opened my eyes. I saw that 20 people around me. I said, what happened? You were unconscious for 2 days. How did I come out? I came up naturally. See, samana takes care of us. I see each one of these pranas, how much it is taking care. That's why when the Upanishad sage talks about this, he feels that, wow, my God, this prana is something taking care of you. Like the mother keeps the child in the womb, takes care of, not only takes care of, but also helps the child to grow. That feeling, that kind of respect that Upanishad sage gets. So he says, Pranasyedam vashet sarvam tridive yat pratishtitam mateva putran rakshasva. Like the way that the mother takes care of the child, srischa prajnamcha videhinaiti. That is a wonderful concept of prana. Such a deep idea of prana. Should we just limit it to one breath that is going in, or the air that's going in, or the oxygen in the air? No. Let's work deeply. When you understand this deeper sense, then pranayama makes a lot of sense, and then we are trying to work at that level when we are doing pranayama. I don't want to take much time because the time is up. We have next program to come up. Thank you so much.